just checking the provider orders for Robert Crowley. Looks like we have an order to transfuse 1 unit of packed red blood cells over 2 to 3 hours. I'm just going to verify why we're doing that. It looks like the patient's hemoglobin is low and their hematocrit also looks low. So that's the reason why we're doing that today. So I'm just going to verify the blood typing. It was done this morning. It's B positive, so within the last 72 hours. It also looks like we have a consent that has already been signed. That's what it says here, and I do have the signed consent right here. Okay, awesome. So I'm going to go get my supplies. I'm going to put on gloves so that I don't handle the bodily fluids with my hands. So I'm getting B positive from the blood bank, and I'm going to give this within half an hour of obtaining it. So I've got all my supplies. I'm going to bring it into the patient's room. I'm also going to check the blood to make sure there's no leaks, no bubbles, no clots. It's not purple in color, and the expiration date is within our time. Okay, so I'm going to take off my gloves, hand hygiene. Hi, my name is Avery. I'm going to be your nurse today. Can I verify your name and your date of birth?
Hi, my name is Robert Crowley. My date of birth is 12/21.
Okay, awesome. Robert, today we have an order to infuse red blood cells or do a blood transfusion. The reason why we're doing that is your hemoglobin and hematocrit looked a little low, so we just want to bring those back up to normal levels. As we're doing this, I'm going to be sitting in with you for about 15 minutes after I start the infusion just to check for any signs of a reaction. Some of those signs might be fever, chills, hives, rash, itching, or difficulty breathing. So I'm going to be checking you, making sure those all look good, but we're also going to be doing a verification process, make sure we're giving you the right blood. It looks like we've already gotten a signed consent form from you, but I just want to make sure it's okay if we do that today.
Yeah, that sounds great.
Okay, awesome. Okay, so again, I'm just going to go verify these things with another RN just to verify that we have the correct type of blood. First, I'm just going to obtain a set of vitals. I've obtained a full set of vitals and they're all within normal limits. So I am going to go get some of that to verify. I'm going to put on some gloves so that I'm not handling a blood product with my hands. Bring this over as well. So I'll have the RN come and verify this with me. So first I'm going to verify the provider's orders with the blood product that is ordered. So under the provider's orders, I have an order to transfuse 1 unit of packed red blood cells over 2 to 3 hours. I have 1 unit of packed red blood cells. And according to the MAR, to ensure that that is also the same, I have 1 unit of packed red blood cells to be given at 9 through IV just once. And then I'm also going to verify the type of blood that we have here. So according to the blood typing that we checked earlier, which was done within the last 72 hours, we have B positive. On the bag, we have B positive. And then I am going to verify this with the patient's information. So I'm going to come over here and I am going to verify that this is Robert Crowley.
Robert Crowley.
Date of birth 12/21.
Yep.
And MRN is 815-4485.
815-4485.
Okay, perfect. So I am going to scan the patient's ID band. And I am going to scan the blood bag. The MAR is saying that that is correct, so I'm going to continue on. We're also going to check to make sure that the unit number on the blood bag matches the one on the tag. So on the blood bag, the unit number is D9CE850C8D1579.
D9CE850C8D1579.
Okay, perfect. And this was gotten from the blood bank within the last 30 minutes when I'll give it. The expiration date is clear, so we are good to give this blood. So I'm going to go ahead and take off my gloves and move these things out of my way. I'm just going to sign off. We did all of these things. the first RN signs, and then I'll have the second RN sign. Okay, perfect. Okay, and I'll take that over here. And then I'll perform hand hygiene so we can set everything up. Saline bag.
Just grab one.
Grabbing a saline bag for the pass off. So first thing I'm going to do is I'm going to spike my saline bag. I'm going to make sure that both of these are clamped and closed. Okay. All right, and then I'm going to spike my saline and hang that. Okay. I'm going to also clamp my IV line, unclamp this, and then fill this chamber with saline. I'm just going to fill the chamber all the way up so that the saline line is above the filter top. Okay, so now we see that the saline line is in fact above the filter, so that is good. So I'm going to prime the rest of the line, making sure that there are no bubbles. Okay, and that is primed. And then I'm going to get my packed red blood cells. I'm going to invert it 2 to 3 times. I've already ensured that there are no clots, bubbles, leaks. It's not purple. So I'm going to spike this. I'm going to unclamp it as the blood is already, or the saline is already clamped. I'm unclamping the blood and hanging that. And then I'm unclamping the line so that blood can run through the filter, being sure not to waste any blood. Okay, perfect. Stopped it before any blood has come out. Now that I have that, I'm just going to put it through here, and I'm going to clean the IV site that I'm going to be pushing it through. I'm going to clean the site for 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Okay, now that that's clean, I'm going to connect it to my saline and I'm going to flush it. Looks like it's flushing easily. So I'm going to saline lock and remove the saline and connect it to my blood. It is still clamped, so I'm going to run it through the channel. And I'm going to unclamp everything, making sure that that's all clear. And then I'm going to channel select, do IV guardrails, select blood, red blood cells. That is correct. I'm going to start at a rate of 60 milliliters per hour with a volume of 300 for the first 15 minutes. I'm going to start that. Now that that's started and it's checking the line, I am going to wait and make sure that that's all clear. Okay, looks like it's running well. It's been 5 minutes, so I'm going to do a complete set of vitals. That's within normal limits. And then I'll check again at 15 minutes, obtain a complete set of vitals, and that's also within normal limits. So because of that, we're past the first 15 milliliters. I am going to up the rate to 150 so that it can infuse over the course of 2 hours, and I'm going to start that. Now that that's going, Robert, we should be good to leave you by yourself for a little bit. We've already checked. There are no signs and symptoms of a reaction like we talked about earlier, but continue to monitor those and let us know if you notice any of those. The bed is in low and locked position, one side rail up, not two for sake of not being restrained, and your call light is right here. So just let us know if you notice any of those symptoms. I'll be back in 15 minutes to check you at the 30-hour mark or 30-minute mark to obtain another set of vitals, but I'll go document this.
Okay, thank you.